Happy Thursday! It's Thursday night, you guys. It's time for Ask Melissa Anything, where we talk about your life and your body, where we believe your health is your responsibility, that you have a choice in your health care, and most importantly, we believe pain is not considered normal. I'm your host, Melissa. I've been a physical therapist for over 20 years, and tonight's topic, as I see you guys starting to join, I am so excited about. Tonight, we're going to talk about lady parts. So sorry, men, if you're tuning in. This night is not for you. This is not the questions you're going to want to be a part of unless you're one of those very sensitive, very understanding, wonderful husbands that some of us are blessed to have. So like I said, we're going to talk about lady parts, or as I like to call it, your undercarriage. Okay, because how else do we describe your privates? Women's health, basically. Now, hi Lori, so glad you could make it. All right, you ladies, so I got a couple of good stories I'm going to start out with tonight. I want to tell you about a couple of experiences we've had because the topic is a little bit different, and it also means I got to see if I can't see this up here. If you're not comfortable for some reason putting your questions in the chat, which I hope you are, okay, because this is supposed to be a really, really great place to be able to talk about those kind of things, and I want to support you through that. But if you feel like you need to send just a message, send it to the Nephew Physical Therapy Facebook page. You can do a message through there. And if I have my technology right, as I'm, being super techie here tonight, I'll be able to see that. So I'm hoping as I share a couple of stories here to get started out with, that you'll post your questions here in the chat. Or again, if you really need to, you can privately send it to me, to my personal physical therapy, to my personal Facebook page if we're friends, otherwise to the Nephew Physical Therapy page, all right? So the undercarriage, lady parts, all of those kind of things. Now, in full disclosure, I am not one of those therapists who wants to completely get up in your business. And it's not that I'm not willing to, okay? And of course, I'm going to touch my nose, which is apparently illegal these days. But what I have learned about myself, as I've had some babies, as I've been through some different things, I've learned that I have kind of a very different approach to this region. Rather than getting all internal, right, and getting really uncomfortable, it's kind of why we're having this discussion tonight, because many women are afraid to even talk about it. How many of us are actually talking about sex with our girlfriends? How much are we actually sharing that we might be having pain with intercourse, or that you have a leaky bladder, or even worse than that, maybe that your bladder is falling out? It must have been in the last year or so, got to see this lady who had bladder prolapse, which basically means that your bladder is starting to fall through your undercarriage, all right? Which would be incredibly uncomfortable. So what she noticed was every time she went to stand up to get out of a chair, she felt like she couldn't hold everything in place. Now, I don't know about you, but there are different times during the month where I notice that I am looser, right? As we go through our menstrual cycle, we have all these hormones and stuff that change us. And there are definitely a few days of the month where I'm in the middle of my cycle, and yes, we're going to be personal tonight. I'm just going to share some things where I just feel like everything's going to fall out. But that's only on a couple of days. But this individual, probably in her 60s, if I remember, was having challenges with that. So how do you address that? How do you help a lady who feels like her bladder is going to fall through the bottom? Well, here we go again. Here we go with my hands, right? So we start talking about the glutes and the pelvis. Many of us have been taught and told to just do your Kegels, which I will later talk about them even in more detail. But the Kegels are really designed just to activate some really small muscles on the bottom of your pelvic floor, okay? If you go one step out, okay, what you'll have is you have your two halves of your pelvis, okay? You have two halves of the pelvis, the bones, okay, that kind of they each create half of a bowl, all right? And what you have on the outside of those big, massive glute muscles, okay? And so you ladies who think you have too much junk in your trunk, I'm telling you, it's a good thing. Lots of muscles there, but what we need them to be is strong and symmetrical, because those muscles then attach to parts of the pelvis at the bottom, and that's where then the tiny muscles attach further as we move towards your urethra, your vagina, and your anus, okay? Those are the words we're using, folks. That's anatomy. That's what we're using. We're using proper terminology, or undercarriage, as I like to call it in general terms. So we're going through those areas, all right? So what happens is, yes, we need to be strong down there, but it's uncomfortable. We don't want people necessarily messing around down there. And in this situation of this lady with the bladder prolapse, our approach was she was really, really weak in her hips and glutes, core muscles, okay? And so when I talk about the core, I am traditionally talking about butt, gut, and hamstrings, okay? Because if you get, and this repeated message in almost every week that I've been talking, is that we need our glutes to engage, and when we get those to engage, we get our hamstrings to engage, the lower abs will follow. Okay, did you hear that? Everybody wants to be stronger and have better ripped abs, right? Stronger core, all those kind of things. But you need the glutes to engage. So a pelvic tilting motion, okay, which we're going to have to do another video because I'm just having this conversation in my bedroom this evening. When we roll through, all right, those glutes, you tuck that pelvis like you're rolling that backwards, lower abs will follow, and they're really hard to engage. That's why 8-packs start at the top and fade at the bottom, and the men that I know that have them, all right? So in this lady's situation, that's what we focused on. We focused on all the different hip activities we do for people with knee pain or back pain or hip pain or all of those things. And she got everything to kind of hold up in there, okay? Because we addressed the large, big muscles, all right, ladies? So being strong in our hips and all those things, super important. Now think about this, and again, if you have any questions, please put them in the chat. I'm really hoping, because I think we could all learn some stuff from each other, and I'm so excited to see so many familiar faces across the top of my screen here that have joined us this evening. Many women, as I have met them or talked to them or whatever, aren't starting out though with pelvic floor pains. So my question, if you or somebody you know is having incontinence issues, and that's, again, that's a little bit of a tricky territory because of course the more babies we have, the looser things get and the more they get stretched out, but it doesn't mean you can't rebound. I don't believe that at all. Is the fact that, oh goodness, I lost it. I don't even have mom brain. Look at that. This is hilarious. This is what happens when you go live and you're like, I'm on a train, I'm on a thought, I'm going. Ask your questions. Where was I at? Somebody. I'm just going to laugh at myself. Is that most people who probably have pelvic floor issues have a history of low back pain, hip pain, knee pain, or plantar fasciitis. I found it. I found it up in there. Does that make sense? So what we often see in the clinic is somebody will come in with the new symptom. But as we peel things back, like in the lady that I was mentioning who had bladder prolapse, history of back pain for decades, okay? Decades of back pain. So this didn't just start out of the blue. She just one day didn't wake up and felt like everything on her inside of her body was falling out, okay? And when we talk about early prevention, on some of our other videos, we're talking about how do we avoid joint replacements, okay? How do we avoid rotator cuff tears? How do we avoid these things? It's by being stronger. And so these are precursors to sometimes having more intimate issues, okay? And so we've got to peel those kind of things back. One other thing, and I will tell you, this was probably, I have a lot of favorites, let's be honest. When you get a chance to treat somebody and you build a relationship, because we spend a lot more time with people than a lot of other professions get to, that one-on-one for an hour, where we're getting in there, we're touching you. I mean, I got to rub some good glutes yesterday on a friend. I mean, a client who needed it and gave her relief, and then did some follow-up, strengthening, all that kind of good stuff, right? Like we get in there and we're really personal with those kind of things. So one of my other favorite, again, many favorites, is I had the privilege of meeting young, healthy 40-something, okay? I mean, on the street, you would pass her and think she was in perfect, excellent physical shape, exercised, worked out, did all of these great things. but I had pain with intercourse. And I believe, as a physical therapist, which people don't want to talk about this, but sex, intercourse, intimacy with our spouses is truly one of God's greatest gifts to us, okay? I believe that fully, and it is functional. It's why physical therapists should be talking about it. It's why I've been asked questions if you've had shoulder surgery and you want to be intimate with your spouse, how do you make that happen? These are the questions we should be answering for people, because this is about how your body moves, okay? And so, again, you're envisioning this young, healthy, totally fit, pain, lots and lots of pain, can't tolerate it, okay? Cannot tolerate, good question, Erica. I will get to that. Let me finish this story, and I'll come back to yours. Could not tolerate it at all. Well, as we evaluated her and started peeling back those layers, it wasn't so different of an evaluation from somebody that I haven't seen for back pain, again, hip pain, knee pain. There was a rotated pelvis, okay? There was a really tight hip flexor on that right side, so we had to get in there, release that. We started on the outside of those glutes, and keep in mind, you have layers of muscles through those glutes. You start with the glute max, the glute med, and the glute min, but you peel that back, you've got these beautiful diagonal muscles, all of those working. Again, those tie into the pelvic floor, and there are also some muscles that are deep inside your hips and pelvis that you can get to. It's slightly uncomfortable, right? You might have to go just inside of maybe your butt bone, okay? Little close to the crack maybe, but we can get into some of those areas without having to be personally invasive. And the reason I mention that is because it's scary. And a lot of us are not comfortable getting our annual exam, let alone having that be a part of your physical therapy. So it took a while. And part of the reality is as busy moms who work, those kind of things can be very, very hard to make the time to do that. But we stuck with it. And yeah, it took a little longer than normal because there were some hiccups and those kind of things. But I remember the day when she came in and shared that she was able to be intimate with her husband without pain. That is something we should be cheering and celebrating, because as I would like to say, in our marriages, right? Like, that's a good sign that we still like them, right? When we want to be close to our spouses and love on our husbands and do all those things, like, that's so, so important. And so it was really not that she was weak, it was that she was twisted and asymmetrical, and she worked out all the time. But that's where exercising often isn't enough. We have to be more specific, more detailed. We have to figure out what is weak, what is strong, and look at that whole region. Again, hips, pelvis, undercarriage, abs, hamstrings, all of that together. And so peeling back those layers, very helpful, very exciting. Lots of hands-on work, lots of manual therapy, all those kind of things happening. But we got in there, worked on it, and provided her with relief. So such a somebody get her life back. All right, Erica has a question. Will an injury cause imbalance of pelvic floor and lower core muscles? I have a torn labrum in my hip and wonder if the compensation of the surrounding muscles protecting labrum hip will later result in an imbalance I'll have to deal with. That is an excellent question, and we actually have the privilege right now of treating somebody who has had to have their labrum repaired, okay? And so the first thing is determine if it's surgical or not. And that is a tough decision to make. Sometimes it's one where you may want to get one or two opinions, because that labrum, for those of you who don't know, you have that ball and socket joint, and that labrum kind of provides some cushion in there, and it can tear off the bone, basically. Kind of can create a flap, okay? Or it can tear somewhere in that socket, and it can pinch and all those kind of things. So Erica's question is, can it cause imbalance in the pelvic floor or lower core muscles? I would say yes. Now, I would also ask the question, was the imbalances present before that to a labrum tear? That depends on if there was something traumatic or not, okay? So definitely there are situations where we're gonna have traumatic labral tears. That's gonna be in the shoulder and the hip. That stuff's just gonna happen, right? Car accidents, we fall out of trees, sports injuries, whatever, right? Things can tear traumatically. But if something wears and tears over time, okay, and I'm really, if you have a torn labrum, I'm really sorry, because that can be so pinchy. And then what happens is you're compensating. Basically, what you're wondering is that imbalance is going to start happening. Now, naturally, again, what we see is those hips are slightly askew, they're not level. That seems to be a common pattern, whether you've had kids or not. I guess just got asked that question the other day. I see it in men too. There's a couple of theories that aren't totally tested, so I won't share those here because they're speculative. But because I've just have seen it for 2 decades, where there's that pelvic rotation that happens, that right hip flexor is commonly tight. And then we've got a loss of glute strength, loss of sideways strength, loss of rotational strength. So it could be a couple of different things, Erica. You could have already been a little bit rotated, and this injury or this pain, yes, could continue to cause you to use your body asymmetrically, right? You're not walking equally, possibly you're not extending that hip equally, so you're not using the glute as well. You get tighter on the front. The back can start compensating. That's a real common thing. And that compensates in an opposite contralateral pattern. So a right weak glute will show up with a really tight left low back. It's opposites. So some of those things, you have to deal with. So without, again, always the disclaimer with every talk that we do on Thursday nights is without putting my hands on you and touching you and evaluating you and all those kind of things, I want to just give you some stuff to think about. But traditionally, the things that we want to make sure is making sure that we're maintaining normal range of motion, and that often, again, that depends on what's happening in that hip socket, but from a area of your body that you can affect, we're talking about hip flexor stretching. Some of that's tummy time, so being on your stomach. Some of that is going to be like bridging, glute activity. And that's where we start with a lot of our patients, is we start very basic, flat on the table, because we want to do things where you can't compensate, because the body does an amazing job of keeping us moving and compensating, getting everything else going. So I'm curious, if you don't mind sharing, Erica, what hip is it? And again, that's only based on some theory, so if you're willing to share, that would be great. I'm just wondering if it's the right, because I have some theories about how the right hip kind of wears down over time. It may or may not be, and again, whether or not it's traumatic. But that's where I would suggest you're working on hip flexor stretching. That's the tummy time. Tummy time, that's the glute work, that's the bridging, lots of holding. Planks aren't bad if you can hold that and do that well. All of those kind of things. So I hope that helps. Some things to think about. All right, I have another question. Let me see if I can find it here. Goodness gracious. Oh, it's your left hip and you had surgery? It's torn again. Oh my word. I'm so sorry. I would want to make sure, if you have to have surgery again, I guess I'm going to get a little technical as a therapist here, and this is what's so hard sometimes, is make sure that when you are done, if you do therapy again, make sure that you are strong in hip internal rotation, hip external rotation, adduction, and extension, okay? Because only because I have seen people after, say, a total hip replacement where they did a whole bunch of therapy and then months later they still weren't better, and nobody ever addressed the rotational component of the hip. And that is, the obturators is the fancy term for them. But if we don't get strong side to side and rotating through that pelvis, we're going to not be using those hips and pelvis equally. So I'm so sorry. Like, that just breaks my heart. And because I know that you're not local, I still want to get my hands on you and help you. So there's some things to think about, but yes. And then in regard to that pelvic floor, yeah, it may spill over into that area for sure, and cause things to get a little bit twisted, rotated, those kind of things. So some things to think about. All right, I just got a question sent in more anonymously, which I respect. What can you do during pregnancy to prevent future problems? Number one answer is going to be butt strengthening, which is such a good thing. As I like to, when we're talking about pregnancy issues, my favorite analogy is your body is getting ready to push a watermelon through a garden hose. Okay? A watermelon through a garden hose. So your body really has to open up and stretch. Okay? Now, what's funny is the first pregnancy, it's never done it before. All right? And so, at least in my situation and what I learned from my OBGYN is delivery is longer. And it takes, but you don't get as big. The second pregnancy, your body's done it before. So it can stretch to that previous point much faster. Okay? And then we get bigger. But I'm telling you, delivery was way faster, right? Like, body already knew how to push all that stuff out. What we're thinking about, though, is as those hormones are being released and as those ligaments, which are designed to provide stability, okay, they're not, I'm going to make somebody mad, I'm sorry, I love you all. They're not made to be manipulated. I would not recommend getting your SI joint manipulated while you're pregnant. That is my belief. You can be mad at me later. But you want that to provide stability. Now, what will happen is if while you're going through pregnancy and your body is shifting, changing, those hips are getting wider, I don't think I'll ever be able to put my wedding dress on because my rib cage expanded too and my hips expanded, and that's just not going back because that's bony at this point, no matter whatever happens. But as we're moving, if there is some underlying rotation, right, like what we were talking about with Erica there a minute, whether it was before or after the labral tear, as we're talking through those things, if you're already a little bit crooked, it will magnify that, all right? And it may show up as sciatica, may show up as low back pain. You want to be doing things that engage your glutes, all right? And for pretty much the first 20 or 30 weeks, you can do things on your back, okay, which is great. So we were mentioning bridging before. Very, very simple. You're laying on your back, your knees are bent, and you're just squeezing those cheeks. I like to pretend that actually you're more motivated if it's a $100 bill. So you're pinching those cheeks together and you're lifting that butt up. And you're just holding and focusing on that glute squeeze, and you're focusing on engaging all of that, pushing through your heels, not through your toes, because that will get hamstrings to engage more. And you want to be relaxed in your belly. Okay, so don't brace and hold your breath. But just that simple lifting motion to engage all that stuff also opens up the hips. Working on that motion, very important. The other thing, which I realize I need to do this video at some point, probably in the next week, is to show everybody how to do some clams. Clams is where we take a ring band, which is one of my favorite little simple tools, and you slide both of your legs through it, so it's around your knees, and then you lay on your side and you separate your knees apart. So you get resistance, but it works your hips. And again, while your body is changing, while you're pregnant, as things are shifting and moving, you need all of those muscles to follow along, okay? You need them all to be working as things separate and open, okay? So can there be some aches and pains? Yes, but if we're starting to have sciatica, if we're starting to have consistent low back pain, my philosophy is this: you're going to probably meet your deductible, so you should do physical therapy. And here is why. Makes me think back to, again, another one of my favorite clients who I remember all kinds of pain. And I'll tell you, it is the simplest therapy because we're going to give you a good glute massage. I'm going to get in there and rub those buns, okay? And the great thing is, as your belly is growing, you can lay on your side. So we don't have to worry about getting you on your tummy, okay? Work a glute, flip to the other side, work another glute. And then, because those glutes are often really sore, because we're talking about that's where your pelvis is, right? And that's where the SI joint is and the hips and all that stuff. And those big, big muscles we've been mentioning. So we get in there, we loosen those all up. Then we strengthen them. We strengthen them sideways, we strengthen them, we work on rotation. And then as the body some things where you do stuff on the ball. I've done some stuff like that where you can maintain that strength. That sets you up to go into your delivery with a nice level, stable pelvis instead of being rotated or twisted, okay? Now, it can create some mild torsion. It's not something that affects the baby. That's not what I'm talking about. But I'm just saying setting that hips and pelvis up for success and living with pain and pregnancies, just don't accept it. It's not normal, okay? So doing those kind of simple things, if you're a runner or you walk or you do those kind of things, keep doing that stuff. It makes me think of another friend who I know, I don't know how many miles she ran the day she had a baby, right? Like she would wear her belly bra and her sports bra and just would go running, okay? But that's what she was used to, and her body could handle it. So keeping active, continuing to move, totally a good thing, but you've got to make sure that you have the strength to hold everything, and that will really, really make a difference. So it's an excellent question. Yes, while pregnancy is sometimes a good excuse for us to binge and enjoy some different things, because I'm trying to think. My one kid, I wanted Coca-Cola for some reason. One kid, I wanted watermelon, right? So whatever our cravings are, but staying strong in your hips and in your butt will carry over to support your pelvis. Okay, there's that carryover effect. Will make a big difference. Natalie, I am so sorry you never got a butt massage when you were pregnant. Totally missing out. Totally one of the greatest things in life is getting those glutes rubbed. I'm telling you, you will be surprised at how sore you might be there. And it may be where some of your problems are coming from. So these are good questions that we're talking through. And apparently Liz would like her glutes rubbed as well. I love it. What other questions do you have? I have some other things I can just keep talking about. Something that will be, I'm just going to say it because I want to talk about something here that and uncomfortable and sometimes makes us laugh and giggle. But I've been wanting to say it in a public forum. And so let's talk about those Kegels a little bit more. Oh, and Rachel wants to talk about leaky bladders and why it's not normal. Okay. And I know moms that have this that are just living with it. Yes. So let's see. I'll tie these two things together. All right. So we've talked about the big muscles, the glutes, the rotational muscles, the sideways muscles, all of those big muscles need to be working. They need to be working equally, and they need to be supporting each other, okay? Because if somebody is not doing their job, something will break down, okay? So we need to start with those big ones. Then that carries over now. Then we might need to do a little bit more isolated work on that pelvic floor, okay, on that undercarriage. And so we talk about things like Kegels, okay? Now, Kegels can be a really hard thing to teach. I'm trying to even think if I can describe it. It's a drawing in an upward motion that you're pulling up through your pelvic floor, kind of through your vagina, up and in, okay? And so when we, in some women's health clinics, they'll do things where you use a probe and you can provide biofeedback or you squeeze on it and there's a machine that reads to let you know. I will admit, it's very hard for me to hold a Kegel contraction for more than a couple seconds. And that means I'm very, very weak. We should be able to contract and hold, okay? Kind of that drawing up and in and contracting, all right? And when those muscles are strong, that helps with the leaky bladder, okay? Big muscles have to be strong. Small muscles need to be strong. We need all of those things working together, all right? And so whether we're talking about pain with intercourse, or we're talking about hip and back issues, or we're talking about a leaky bladder, we're gonna need those pelvic floor muscles to engage. So before I talk about some of the activities you can do to get that stronger, I do wanna mention that depending on, and when we're talking specifically about those of us who've had vaginal deliveries, if you have torn, or if you've had an episiotomy, those are things that can affect the ability of your pelvic floor to contract. I am not a fan of episiotomies, and let me explain why. And this is something I had learned a long time ago. And I'm not looking to get in a dispute with an OBGYN or anything like that. I am just saying these are the things as a physical therapist who loves muscles and loves them working and contracting, knows that once a muscle is cut, okay, it doesn't just get sewn back together really easily, all right? So an episiotomy is, the example that I was told is it's like taking scissors and you're cutting your shirt and then applying pressure. It rips much easier than just pulling on your shirt, okay? So I am kind of in the middle on the spectrum of birth, all right? I have friends who can deliver and is one of the most glorious women I think I know. And then I know women who do planned C-sections, right? There's a spectrum, and we should embrace that we are all different kinds of women, all right? The reason I'm not in favor of the episiotomy, though, is that we are automatically cutting, and because it cuts backwards, again, I'm going to use the anatomical words here, it increases the chances that you rip all the way through to your anus. And that's as bad as you think it is, right? Now, we can get stitched back up, but again, stitching things back up, just like with the C-section, which is 8 layers, my understanding is there's 8 layers, they don't stitch you back layer by layer. The whole thing gets stitched back together, okay? So, I'm a huge proponent of vaginal births. I'm thankful we have C-sections because it's a very amazing and saves lives, and so thankful for that. But I think that God intended us to birth our babies through the birth canal, and trying to avoid those episiotomies. And then if you do rip, it also makes it much harder to build strength. So the thing that I wanted to mention here, right, before we all laugh and giggle, is I am going to tell you this. This is what your, Facebook physical therapist recommends. You should practice your Kegels with your spouse. Did you hear that? Anybody understand what I just said? I think you should practice your Kegels with your spouse. He should be a part of it. When you are intimate with your husband and you are having intercourse and they are inside of you, you can squeeze and contract in that moment. Now, I know nobody says this stuff, right? That's why this is a ladies-only adult conversation here. But what I'm telling you is it is the definition of biofeedback. It is absolutely, somebody is going to tell you if you're actually squeezing and contracting something. And because I believe in a healthy, happy marriage of being together, doing that, working on contracting while you're with your spouse, while you're having intercourse, is a great time to practice, and it will probably enhance your experience. All right, I'm going to say that in the most clinically appropriate way possible. But I can tell you it's very hard for me to contract, right? That Kegel exercise, very, very hard. There you go, Darlene. That's my girl. That's right. He will love it. Thank you. And that's one of the gifts we get to give them. Exactly. Bonus for you, you're getting stronger. So if you're having a hard time figuring out how to contract it, that's how you ask for help. And he'll let you know. He'll let you know if he feels it. And what I'm telling you also, though, is if you have all those bigger muscles stronger with it, it all spills over, okay? And so, yes, Kegels are important, all right? But the but is really important. We need all of those things working together, all right? So that's part of what you had mentioned, Rachel, in regards to the leaky bladder. It is something, though, that takes work to fight. And it does probably depend on a variety of factors. This isn't something that probably just goes away. We would want to dive into knowing, is there a history of back issues? Is there weakness? Are the knees, giving people trouble? All of that kind of stuff. And so we have to figure out what that is. And sometimes those become side effects, beneficial side effects that we see of things getting better in the pelvic floor when we're treating larger issues. Makes me think of, one of my earliest clients when I went out on my own. I remember hurt from her knees to her shoulders. Not kidding, everything hurt. And so we kind of just started with the hips and the pelvis, because I refer to that as the foundation or the basement of the house, and we started there and we worked our way up. And one of the interesting things that I learned from her along the way was that we actually improved her irritable bowel syndrome, okay? I was not treating her irritable bowel, okay? Just like I'm not often treating somebody's leaky bladder, all right? But when we started to level her pelvis, not by forcing it, not by adjusting it, but by making sure every single muscle and all of those wonderful dozens and dozens of muscles all through there, we're all waking up, all we're helping, all engaging, the rest of her body leveled out. And so it's an interesting question. I, again, don't know if this is true, but if we're rotated here, who's to say that our internal organs in some capacity and the fascia that holds them all in place isn't a little bit rotated and a little bit torqued as well? So that's where that kind of plays. Irritable bowel, all of those kind of things. So excellent questions. Who else has a question that they want to share? I'm trying to think what else. So we've talked about some leaky bladders. We've talked about, hip issues in relation to it. We've talked about the importance of doing your Kegels while you're having intercourse with your husband. Very important. And we've talked about, yes, Hannah, the IBS. Absolutely. We've talked about that, those side effects. And so it's very interesting as we peel back somebody's history. Oh, I have one more thing that I want to mention. C-section scars. Hannah, I'm surprised you didn't. We've talked about this so far. All right. So this is a good story. I once had a lady, had her kids over 20 years ago. Old C-section scars. Very, very old. And she had been put through the ringer with internal ultrasounds and scans and tests and all these kind of things. And she had this weird right lower quadrant pain. Wasn't appendix, any of those kind of things. I honestly don't even know how I ended up with her on my schedule, but somehow she ended up in our office because she had this really strange region of pain. And I checked almost everything. Checked the hips, checked the back, did all those kind of things. But she had those scars, all right, which they're pretty low, right? She, the what do they call them? The smile, right? Like it's below the underwear line. And I was like, well, let's check them out. And so 20-year-old scar, I kid you not, we started to move that scar. And when you're releasing scars, you go up, you go down, you rotate, you go side to side. And we found some restrictions. And so when you're releasing scars, you're basically doing it with a little bit of tension over time. So you have to kind of just stay there. And you hold, and it tugs and it pulls because you don't want to rip it. You don't want to rip it free. But we released it. And what I remember is in 4 visits, her pain was gone. Like it feels really miraculous. And she, like I said, she had been put through the medical ringer of test upon test upon test, and they didn't know what was wrong with her. They didn't know why she had all this pain. But the fascial system, which is the white stuff that compartmentalizes meat, that's the best way I can describe it, really uncovers our whole, connects everything in our body and goes everywhere. And releasing, in that fascia, again, I said earlier, 8 levels of tissue through your abdomen that just get all sewn together in one giant stitch can cause things to anchor down. And what happened is she had lost motion of her skin's ability basically to move over her muscles and all that kind of stuff because it should slide over. You should be able to, pull. If you have a scar, you should be able to tug and pull on either side and that skin should move. If it doesn't, if you tug on one side and it doesn't move on the other side, you have a restriction. And sometimes those strange, really weird referral patterns, different patterns where pain moves and travels and does all this stuff, sometimes is a fascial restriction, and we release that. So it's very interesting to do those things. So very cool way to address that. And yes, those bikini scars, they're there. Sometimes those are, when we're dealing with situations that are very strange, I will often ask about your birth history, scars. I've had my appendix out and my gallbladder out. And I once had my appendix scar released 15 or 20 years later, and it made a huge difference in range of motion. So we don't discount the impact long-term of what scars have in our body. All right, I see Shelly had a question here. My doctor is going to be sending me to pelvic physical therapy soon for tailbone pain. Oh, recently lost over 100 pounds. Yay, Shelly. We should all give her a virtual high five because that's awesome. Have I heard of that happening and pelvic physical therapy help for that? So here is the question. Yes, I think it will help you. Your body's center of gravity has dramatically shifted. Okay, so when we talk about getting pregnant, that weight gain traditionally goes forward. Sometimes it goes sideways, right? Depends on how our bodies store it, but traditionally it goes sideways. And what happens when we're pregnant is it all shifts forward, all right? So now we have to balance our body in a forward position, okay? Very, very different. Your body, losing 100 pounds, you lost a person. Again, that's so amazing, Shelly. I'm so proud of you. Is your center of gravity has shifted. So now when you walk, your body is all structurally, your muscles, your joints have all shifted over time to be able to keep you upright, okay, with that additional weight being stored in your body. Now that it's gone, things have shifted and moved. So what I would be curious, if I was your therapist, what I would be looking at is I would be looking, oh, shocker, I'm going to say glutes, right? We would go in there and look at the glutes. When you say tailbone, is it when you're sitting that you're having challenges or problems? I have had the hiccups like crazy, you guys. I'm so sorry. They like pop up every time I start talking for long periods of time. So Shelly, I would be curious, is that when you sit down? Because what I would dig into more, is it the SI joint? Is it actually the tailbone? And I would probably focus really hard on, again, making sure the hips and pelvis and everything are level and working together, because we'd want to figure out how your body has been compensating over long periods of time for that. Like that absolutely makes sense. And when we're carrying extra weight, what often happens is we overuse our back, okay? We stop using our glutes. Traditionally, you'll see people who have much larger calves, okay? We start changing how we use those muscles, all right? And as people get more healthy, right, or make those changes, is aches or pains will show up. So what we would go looking for is, so why? Why is that area of the pain? And that's what I would dig into, all right? Caleb's so funny. It's not the Rona. Caleb, one of my favorite little cuties who I miss. So Shelly, yes, it would be all those different sitting, walking, standing, bending over. Okay, so if it's all those different things, I would be curious if it really truly is the coccyx, okay, the very end of the spine, or if it's, again, like I said, SI joint, hips and pelvis, rotation, all of that kind of stuff, because what you're describing isn't just when you sit down. Tailbone pain, traditionally those people feel better if they sit in a donut, right? They don't want to sit, but walking and standing often feels better. And if you're saying bending over, again, I'm guessing, and I haven't touched you, evaluated you, but it really starts to make me think that it's SI joint. So that it's part of that complex of where your spine comes down, it sits on your sacrum, okay, that then connects to the pelvis, all right, and then you have your tailbone right down at the bottom, which helps pivot and basically protect your anus a little bit. That's where that comes around there. So if it's all those different things, we would figure out which part of that, and the pain indicates some of that stuff, but then we look at function. We look at how you bend over. We look at where the flexibility is or isn't. We look where you're strong and where you're weak. We peel back all those great layers and slowly rebuild your body. And that's where I don't, in most situations, like starting people doing standing exercises. Shelly, we do. This is why I'm talking about it. It is that we do. Yes, I don't know where you were at in the discussion. We were talking about, we've talked about pain with intercourse. We've talked about bladder prolapse, pregnant women, all of those kind of things. Yes, I have treated all of those, and that's where we want to kind of figure out, we'd want to figure out what that is. And I would be very curious, right, on what aspect is affecting you there. So, yeah, it's a very good question. Very interesting how that all might play out. But, oh yeah, what I was saying, and before I got distracted by the screen, is we start with you usually in non-weight bearing, okay? We start with people either sitting or laying on their back because we need to rebuild muscles. Again, I've repeated myself already, but we find that that is when people compensate. We don't start with squats or lunges or wall sits. Those are great ways for you to compensate with your back or your calves or everywhere else that you've been working really hard. So yes, we kind of work through those kind of things. So absolutely makes sense. Absolutely could be beneficial in peeling back those layers. So excellent. Thanks for asking the question. Oh, good, Lori. Lori picked up a foam roller. We've been talking about all kinds of different things the last few weeks. So, Lori, I hope that that is helping with your posture and opening some things up. If it's the first time laying on a foam roller, I'm going to take a little side note here. Goodness gracious, squirrels everywhere. All right, let me finish what I was saying to Lori. If you notice that while you're laying on that foam roller, that it's a little uncomfortable on your back, that's not abnormal, okay? Because you're basically putting that foam roller and you're squishing your chin between your back. So start with a couple minutes and build up to the 5 minutes in case it's too much for you. Yes, Shelly. And yeah, I'm just going to put this out. You guys, you have a choice where you want to go. All right. You came in really late. Watch the beginning. I'll share this later, and you can watch some of the stuff that we talked about before. But I think it's really, really important for people to know that they have a choice in their healthcare. Also, why I advocate for you to be asking good questions, and that's where half the time my objective or my goal on Thursday nights here is that people are thinking about why their body hurts and who they need to go to for help, because we just don't often ask for it. We don't know. We don't know the questions. We don't know the questions to ask to know where to go to get help, right? We ask YouTube or we ask WebMD. We talk to our doctors and primary care physicians. I will always say this, highly valuable. I love our family doctor. I love him. But they're triaging what people have. We have worked very hard. I have worked very hard, and the team at Nephew has worked very hard to be experts in your muscles and your joints and in your ability to do well and to dig into that stuff. And so you have a choice where to go. The challenge is that some of the doctors are going to have their favorites. Now, of course, that's not a problem if I'm the doctor's favorite, right? If your doctor says, come see us, well, then I like that the doctor recommends it. But if the doctor recommends somebody else, I don't like it. But I think it is good to know that you have a choice, okay? You can really go wherever you want for your physical therapy, for your testing, for all of those things, all right? So whether you live in Holland, Michigan, where we are, or you live in Tennessee, Texas, Washington State, wherever, take the time to choose wisely, whoever that is. I always believe you should have a good relationship with your PCP. I think you need to know them, you need to trust them, you need to have a relationship with them. Even if you're somebody who never goes to the doctor, do the annual physical, connect with them, have a relationship with them, because when you do need somebody for something, you want to have somebody that will see you. And we see people all the time who get dropped by their providers because they haven't been to their office in 5 years, and now they have a need and they don't have anybody to call on, okay? And so very, very important to know that you have a choice and should be asking questions. Maybe in one of the future videos we'll talk about what I would say is what I would do to pick a physical therapy place, and not just to say the answer is Nephew. Of course, that's the answer. But again, because I have friends all over the country, different things I would give you to think about. All right, Rebecca has a question. Should we be doing different exercises for stress as opposed to urge incontinence? Oh, are the exercises the same for all incontinence? Okay, so for those of you who don't know, stress incontinence versus urge incontinence. Stress is probably more when you're jumping on the trampoline, okay? The stress of gravity and jumping. Urge is you just feel like you always have to go. That is a, let me see. Is there a difference in the exercises? I'm going to say no, because weakness is weakness. Now, how we train that is different, right? We train for long distance running versus sprinting differently, okay? Those we do look at differently. But I think it does depend on the individual in some capacity, whereas, for example, if you're a floor nurse and you're standing all day, or a teacher who can't necessarily get to a bathroom all day, that may be a different level of stress than somebody who sits at a desk and works there all day, right? Like your access to the bathroom. And I know that some of that stuff very much is mental. And even the idea of feeling like you always have to go to the bathroom before you go to bed. I don't know about you guys, but this is that mental battle as well. I may have I brush my teeth and go to the bathroom before I go to bed. I don't know if that sounds like you, but those things are, and then I climb right into bed. I've got to do those things right. Now, if I brush my teeth and go to the bathroom and then say, go back out to the living room and watch another show, and 30 minutes later, let's say it's 30 minutes later, I'm about to go to bed, I feel like I can't unless I pee one more time. Isn't that silly? Even though I may not have to go. And so some of that stuff very much, I think, connects to that, right? Like there's the psychology of it. I do know, and I'll admit, right, like some of that incontinence stuff varies from person to person, and it depends on where we have soft tissue tension, what's causing it. You also may need to look at diet, right? So there's a lot of different factors that play into that. Yes, right? And different, we address those things differently with each individual. So, but definitely if we're talking about stress incontinence, right? Where it's, and I think about, who I play volleyball with, or sneezing, coughing, trampoline work, weakness. And you can get stronger. You can get stronger until you die, all right? There's great research that shows we can definitely get stronger well into our 80s, all right? So we don't give up, all right? We don't just accept that we're getting older, I'm gonna get weaker, any of those kind of things. So yes, being strong and holding all that stuff all up in place, super, super important. So good. Anybody else? Let's see. I'm gonna wrap up by 8. These have been some great questions, and I am so thankful that all of you have joined. Like, this has been so much fun to talk about lady stuff, right? And to know that you're not alone in the world on these different things. Since I'm not seeing anything else pop up, I will end on this. Women, in my experience, and I've been a physical therapist for 20 years, and I've been a woman for 43 years. And now that I am a mom, wife, and business owner, and now I'm a homeschooling parent, and I'm trying to save a business, and I'm in quarantine, and, right? Like, we all have 50 zillion more responsibilities than we did 2 months ago. I have often seen women, before I got married and had babies, not take care of themselves. I now fall into that category as well. And it is really easy to put the needs of everybody else ahead of yourself. And especially when we're talking about intimate stuff. If we're, you're still walking fine, you didn't break your arm, you didn't sprain your ankle, right? Nobody can tell that you're in pain. Nobody can tell that you're afraid to cough or sneeze, that, you might wet yourself, that your bladder is falling out every time you get out of a chair. Those are things we don't talk about. And sometimes it is labeled as normal. You had a baby. Just accept it. Well, that is not normal, you guys. And so I want you to know that we have a team full of women, which was never the plan. So don't worry, Matt, I'm not discriminating against you on purpose. But we have a team full of women who care about taking care of people and taking care of women specifically with these kind of issues in a way that you can have confidence that you'll be listened to, that we work through it with you. You're going to have to work, believe me. And once in a while, we're going to, have some uncomfortable muscles we're going to have to get to. But know that those things are not normal. I don't want anybody to accept that they have to live in pain every day. I don't want anyone to accept that they can't, that pain with intercourse is normal in your healthy, happy marriages. It is not okay. And so if you're looking for help, I'm hoping you'll give us a chance to help you. If not, if you're, again, somewhere else in the country, find somebody. There's somebody who knows somebody that does this stuff and does it well. And find those people. Build those relationships. It is my belief that everyone should have a great relationship with their dentist, their primary care physician, and you should have a physical therapist. So that when you need somebody to get in there and address those different needs that you have a place that you trust, that knows you, that cares about you, wants you to get better, and then we'll kick you back out. So thank you, everybody, so much. This was so much fun to talk about lady parts. Next week, we're going to talk about knees, all right? The difference between pains and strains. You'll be seeing some posts through the next week that'll get you thinking about what's going on with knees, why those knees hurt, what to do to get them feeling better. And in the meantime, you guys, if you need anything, reach out to us. We're open, kinda. We're doing what we can in this time, but we're definitely taking care of those of you who need it. So don't be afraid to reach out. And of course, you can always message us here. If you have a question that comes up during the week, let me know. Somebody sent me one, and we did a video this last week, pop-up video on Monday night about pillows. So again, thank you everybody for joining me. This is Melissa Meisty from Nephew Physical Therapy reminding you pain is not normal.